Get started. First off, thank you all for coming. I wish we had this participation on all public health meetings of importance. Granted, this is a little unique because there's actually some money to throw at these initiatives going forward. So I understand that's got a lot of folks' interest. The real key of our success will be if this room is this full in 6 months. We come back in 6 months and you guys are all still here and we're working together and we're coming up with the appropriate strategies and expectations to push to the commissioners to their final stamp to send out these new monies. I think that's a huge success. In 6 months, if it's the 12 or 15 people that have been involved with THA over the last 3 years, while it's great they're here, and I know they'll still be here, they've been champions, I think maybe we failed. Does that sound fair enough to start off? Okay. So I want to start off today with giving just a quick overview of 1A, how the campaign went, and this is my perspective. Some of you were heavily involved and maybe have different perspectives. Talk about the road ahead, what we need from all of you, and just some expectations you should have, because there's a lot of false information out there, and no matter how hard we try to communicate and share videos and use social media, the message got turned around a little bit. So hopefully we can clarify some of this. Does that sound fair enough, guys? Okay. So first of all, you guys are all aware 1A passed. It passed with like the highest margin anybody could ever imagine. In fact, the political consultants that we used said, man, if you got a 60% win, it would be like the biggest landslide ever. But we got a 74% win, okay? And the reason why the voters, I think, the community, you voted for that, was the massive need. The need is here. The need is real. All of you guys work in the field of mental health or have a passion in mental health that affects you individually or your organization. The need is there. When I started off here at the county, no one believed that we would have a steady funding stream of mental health dollars a year from now. It wasn't even on the radar, let alone potentially upwards of millions of dollars in the future, okay? So we've gone a long ways. But now that we've finally secured funding coming through, we got to now prove that we can spend it the right way. And we got to have results. So one of the things we're going to do today, many of you might be thinking you're going to get your project funded today, or the money starts coming out of trees. First of all, there is no money today. There's $0 still. The money will not start trickling into the coffers until after January. And we don't know exactly how long it's going to take to build up or what it'll exactly look like at the end of the first year. We have a lot of models out there we've shared. We're starting at 2.5%, but we don't know how much is going to be sold at the dispensary, recreational marijuana, and no one's ever assessed how many pounds of marijuana are grown here across the county. So there's a lot of unknowns. But what I can assure you is when the money is available, we're going to have a detailed plan that addresses true needs in the community. It has true organizations or individuals addressing those with peer accountability to the public. So those of you that were involved in the campaign, and I gotta just call out Agnes, because if Agnes didn't start her own personal campaign over a year ago, right, Agnes, with the parade, we would never be here today. I'm certain of that. She was also the first one that started the funding for us and got us going, and immediately Kaiser, Susan is in here somewhere, there you are, jumped in and really got us rocking and rolling. So a lot of you had a lot to do with this, but now comes the hard work. What we heard from the public is, we don't trust the government, you don't have a plan, what are you going to do with the excess money? So I want to cover all those things just right off the bat. And we have Randy here covering from the Daily. He's been a great reporter with us over the last 3 months covering this, so it's great. He's going to share our successes and or failures as we go forward. Hopefully we don't have failures. So one, how are we going to decide who gets the money? There is no decisions made. So I've gotten calls from some of you in the room sharing news stories with me saying, is this true? Is this where the money's going? And I was like, they're not getting the message, right? We have a website that clearly says what the plan is. We have resolutions from the county commissioners that say what the plan is, but no one's reading that because we get caught up in what's going on in the discussion. So there is no pet peeve projects at this time. This committee, moving forward, is going to make recommendations to the county commissioners, and they are, I'm certain, going to approve those recommendations based off all the research we're going to do and data gathering and bringing everything together. And then those projects are going to be funded. But right now, there isn't a single project, either in the Roaring Fork or in the Eagle Valley, that's already slated to be funded. Does that make sense? So ultimately, there's an oversight committee. We got that into the resolution. You guys are it. If you choose to participate, we will make those recommendations to the county commissioners. Hopefully it'll be a quick rubber stamp because we'll have done all of our due diligence, and then those projects will start getting funded as we go forward. So that's the first thing, and hopefully we're perfectly clear on that. So none of you are going to get blessed today with the funding of a project. It's going to take months of work on our end, all of us here, to decide how best to do that. Second, trust in government, okay? We are videoing this meeting right now, and so all the meetings that we have related to these dollars are going to be recorded. So in the past, I know in public health community meetings or in maybe your community meetings, there's a lot of grandstanding. My thing is better than yours, and these people need to fund me. You can grandstand all you want, but you're going to be in front of all the voters, okay? So we are here to talk about the true needs, the true gaps, to work together as individuals and organizations to find the best way to fill them. And I'm going to invite Randy to every meeting moving forward because we want the public to know that we're taking these funds very, very seriously. If we knew how to do this the right way, any one of us, the problems would all be solved. We need all of us in this room working together to come to solutions that we've never had in this community. Fair enough on that? Okay. So to get started, can we go to the Trello board real quick? So we've been trying to think about how to organize all this in our minds, but also share it with the public. And this is a draft idea, but this is going to be available to the public and to you. So we're going to start off by having these meetings, and these meetings will be quarterly, but in between meetings, there might be homework and follow-up, and that is why we are gathering all of your information out front, okay? So we're going to have meetings, recorded notes, all the decisions made will be available to anybody that wants to see them. But from these meetings, certainly these first 6 months, maybe even a year, we have to really figure out what are the gaps. Where do we have the biggest impact with these dollars? Is it in my own personal favorite project? Or is it in something that as a group we talked about, boy, if we address this need, this has the biggest impact in our community. So we're gonna go through the gaps. Right now, one of the biggest gaps is situational awareness about what's going on across the region. I can promise you, nobody in this room can tell the rest of us all the mental health services systems, how they all work, how someone gets into them, and how they all link together right now. Is there anybody that can describe that? No way. And I've been spending all of my time for 3 months trying to understand it. I think I might have like 5% of it. Some of you might have 10, 20. Others that have been in the community, like Molly and stuff from Mind Springs, might have 80%. But there's probably a lot of private sector work going on, other nonprofits work that we don't see how it all integrates. So we're going to start on that today. We're going to start doing situational awareness and looking at that. What's going on in our schools? This became a big topic over the last 3 months, where I would hear from parents, the kids they're not getting services quick enough. Sometimes it's 2 to 3 weeks to get in to see a counselor. But yet I talk to other parents or other political figures that say, oh, in my kid's school, there's all kinds of great resources. They're doing anti-stigma campaigns. They're doing bullying campaigns. But we don't know for sure. There's 28 schools in the Eagle Valley School District. We have a bunch of schools also in Basalt that are part of the county. We are currently doing a survey of all mental health counselors in the schools to ask them specifically, do you have the resources you need? What additional training do you need? What are the gaps? So we're looking at the schools. Crisis beds. This was the big thing that the campaign was built on. We need crisis beds. We have no crisis beds. When the campaign started, I thought there was only 2 ways to have crisis beds in this community. One was through a new shared use facility that we were going to build in Edwards, which we're still building. And we can talk about that more if you want. And then also in the Roaring Fork, working through Mountain Family Health Centers, also there as well. Then I met Michelle with the Hope Center, and they have a vision of having crisis beds. I said, this is great. Anybody that wants crisis beds, we need to talk to, and we need to understand, because at the end of the day, we need to get crisis beds in this county, not just in Edwards, which might serve this area. There's none also in the Roaring Fork Valley. So we got to assess what's our plan and how do we get them quickly and how do they serve the people we need. We have no detox facility in this county. So I was with most of the folks that are on the detox committee are in this room. We're going to stand up a facility in Bell here in a couple weeks, hopefully by 15th of December is the goal. But this is a temporary facility. This isn't the long-term solution. And folks are donating money. Money's coming from many different organizations to make this work. But long-term, we need a better solution for detox in this area. We don't have a current solution right now that's long-term. Mental health providers in jail. The sheriff's here today, as well as his key staff. We know that the majority of people that are in our jail systems have mental health illnesses and need to be treated and supported, or else they're just going to recycle back in. So we need to address how to do that. Respite care beds, different than crisis stabilization bed. Also, we have none in our community. Access to counselors for adults. So we've talked about students and stuff. What about everybody else? How does an adult, how do you guys in here get mental health services if you need them? It's very confusing. It's very challenging to scope. And there's many, many more, okay? These are just the biggest things that we heard of during the thing. So those are the biggest gaps. And then there's ideas. So how do you address these ideas? Well, I'm putting together a fiscal request to the county commissioners for 2018 to support mental health providers in both the schools as well as the jail. And I'm working with the school district on that, as well as with the sheriff's department, to put that request forward. It may or may not be funded. I don't make the decision on that, but that's an idea that we can tangibly put up here that might fill a gap. So if that gets funded, it doesn't need to come from A1 money down the road, you see? Then we can use that money for something else. Potentially funded initiatives. So after we have an idea, then we actually start scoping the idea. And this is what we'll talk a little bit more today. So we talked about the crisis stabilization unit. So I put the Hope Center up here because they already have a plan in place. They want to move there one day. So we're going to break that down of what's the budget, how much are they short, how many people would serve, is it open to everybody? So everybody can see that as we decide if that's a project we want to fund with A1. CSU with Mountain Family Shared Use Space with Mine Springs. They have 2 facilities, one in Basalt, one in Edwards. Same thing. What's the timeline to get it open? How much does it cost? Who does it serve? Et cetera, so everybody can see. Additional mental health counselors in school, breaking that down in the jail comes from here, add. And then there's finally in flight. So this is after things are funded, and it doesn't mean through A1, this could be through any other organization. Oh, thanks, Brandon, sorry. We have regional emergency preparedness staff in public health, which don't need to give you the background, but they needed a real emergency to work on. So they're helping us with mental health right now and substance abuse. It's fantastic. So they're doing a regional assessment of both mental health and substance abuse, part of what we'll do today, which will fill into all this. So that's how we're going to kind of organize all of this going forward, and we'll have diagrams and stuff. But I wanted you guys to see that there was a strategy in place from the information we're gathering. Is there any questions on anything I've covered up till now? Okay. No, none at all? Okay, so I'm going to turn it over to you two to talk about the regional strategy that we have for mental health. So one more thing I got to mention. Eagle is not on an island of its own, especially the Roaring Fork Valley. There's 2 counties that touch our population on both sides, right? We have Garfield and Pitkin. So we cannot possibly come up with our funding priorities or our strategy if we don't include all the work that's going on in Garfield and Pitkin County. And so the public health departments in all 3 of those areas have decided that moving forward, our regional assessments and our regional priorities are regional. We're working together. So Eagle County doesn't have its own community improvement plan for public health. We are sharing one with with Garfield and Pitkin, And the #1 priority, fortunately for all of us here, is mental health on there and housing, but we're going to focus on mental health today. So I'm going to hand it over to the public health experts to go over this, but we need all of your participation. The meeting, yes, go ahead.
At some point today, could you touch on Total Health Alliance? Is that our name? Are we ever?
Oh, yeah, sorry. I didn't say that. I'm sorry. Thank you, Michelle. So did you guys all see my email? Okay, I want to be perfectly clear. So the Total Health Alliance is this group here, okay? Our only objective is to make sure that when we give the potential scoped funding initiatives, they are the absolute best things we can deliver to the community, and they go to the commissioner's desk ready to be stamped and approved. Okay, that's the mission of this group and the Total Health Alliance going forward. The group that was meeting as a subset of the Total Health Alliance, the REST committee, is still meeting with Sarah, and all that work is still going on, but it's not going to take place in this meeting. This meeting's focus is to make sure we understand everything there is to know about mental health across our region, to know where all the gaps are, and to put clear direction of how to fund those gaps going forward. Now, let's also think about the strategy is $1, while maybe $1 million sounds like a lot to some of you, it is change. It is nothing at all what we're going to need to do to fill the gaps that are going to be up there in a couple of weeks. I promise you there'll be 30, 40 plus gaps. All of you probably have a handful yourself. $1 million is not going to solve it. But we have a lot of very generous people in this community and a lot of big organizations that have already stood up and are already taking huge steps forward on this. And so as we have these potential ideas, these aren't just going to go to A1 groups. These are available for all of us to go out and seek funding and opportunities to get solutions, right? Just like this example I put here, I put in a request to the county commissioners for 2018 to fund the mental health providers in the schools and the jails. If that gets funded, 1A funds don't need to be used for it. Does that make sense? So this group is to make recommendations to the commissioners for funding of A1, but to do that, we have to know everything, because otherwise we're not making strong recommendations. Yes, yeah.
Hi, Chris Nance, congratulations, Eagle, and thanks for inviting Roaring Fork Valley representation. Just wondering what your thoughts are about the mix of Roaring Fork Valley and I-70 corridor. That's what we call you guys, I-70 corridor, Eagle. And we're new to the Total Health Alliance here, so just wondering if you thought about the mix and representation from the Roaring Fork.
So yeah, anybody's invited. If you're going to come, yeah, you're going to come and participate, and show up, and work collaboratively to help us find the best solutions. You're welcome. We wouldn't be doing this publicly, inviting the media, live streaming it if we weren't serious about that. Those that know that, you that know me, I love transparency. So if anybody wants to show up and help and they've got solution, they're welcome. But what we're not going to allow is people to sideline us. We have disruptive people coming in here that are not helping us all move to the end. We got a lot of great law enforcement folks in here, and we'll ask them for our help. Okay? But we are here to improve the mental health system across this county, and we have to do it together. It can't be my idea or Becky's idea or anybody else's idea. It has to be all of our idea, and we have to get behind that. With that, there's going to be some giving and taking. Some of us aren't going to get what we think is the most important thing, maybe funded the first year. But if we come up with a strategy how to check these things off one by one and keep going down the list and keep finding ways to bring funding, we'll get it accomplished. Remember, 4 months ago, everybody in this room probably would have told me that tax is not going to pass. Many of the public health staff in here specifically told me that and stayed clear away from it for fear of that, and it passed by the biggest margins ever. So don't tell me it can't be done. We can do it. We just got to come together and work on it to make it work. So let's get to work. So Becky's going to kick us off and get us started.
Yes.
Steph.
Yeah, I'll switch us over. So Jordana and I are going to focus on this priority gap, situational awareness, about what is going on across the region. And here, our regional mental health dashboard. What are we doing now? So for some of you, especially in the Roaring Fork area, this might be repetitive if you attended some meetings in Picken or Garfield County, but we'll keep it fresh. All right, first just kind of overview of Eagle County's community health assessment. Many of you are aware that Eagle County Public Health and Environment, we do a health assessment every 5 years. Our current assessment is this year. And so we have for the past year been, just moving forward, I'm jumping fast. The past year, we decided to work with our regional partners, Garfield and Pitkin County, to do a regional community health assessment and have shared priorities across our 3 counties and a shared action plan of how we'll work together to achieve some of those outcomes. The reason we chose a regional approach is we found that in our current community health assessments, many of our priorities were the same. And many of our action plans also had similar things too. So it made sense to kind of pool our resources, and also our community members kind of float across our county boundaries. So it made sense. Just a little overview of how we do the community health assessment process. It is a community-led process. It is not public health staff sitting in a room saying these are the priorities. About a year ago, we had a large community meeting where we asked community members what are the biggest health issues for our county and what are the biggest assets in our county. And so we took that information and we took it from all 3 counties and kind of came up with some top priorities. And so that's our community part. We then took our health indicators, so data about our communities, regional or just local to Eagle County. So some of that data is looking at our birth rates, our death rates, but also looking at our Healthy Kids Survey, which we're doing right now in Eagle County around youth alcohol use, drug use, days of feeling depressed, and looking at some other indicators. Yeah, we did that. I'm moving fast. So these are the top concerns that kind of rose to the top after we had the community meetings and we layered that with our community indicator data. So as you can see, probably the top 4 all deal with mental health and substance use, and then healthcare, housing, and water quality. So we found, okay, that's a lot of priorities to deal with. We need to narrow that down even more. So we did a prioritization process and we looked at, do health disparities exist across our community? So are there some groups of our community that may be impacted more than others? Do strategies exist? Does the community support change? Is there political will? Is there momentum? Sufficient resources? So do we have staff, funding? And was this a past priority in our current community health assessment? So as you can see, I can't see from here. So mental health, which includes, we bundled those top 4 together. So that included suicide, substance use, lack of access to mental health services. That ranked number 1. Housing ranked number 2. So those are our 2 regional priorities. So mental health, that's the priority we're going to focus on today. And so the outcomes we really are looking to achieve are increasing the number of people who receive care, reduce suicide deaths, and increase healthy behaviors around substance use for youth and adults. So we're really trying to get that spectrum of not only mental wellness, but also substance use. And then healthy housing, just to touch on it, we will be focusing on quality, affordability, and community connectedness. So if anyone in this room is really wanting to talk more about healthy housing, stay tuned. That will be happening in the future. And then there's some additional concerns for Eagle County that are more county specific, that aren't regional priorities, but for Eagle County. Systems integration, so how do we integrate our behavioral health, our physical health, kind of our community health? How will we work together to integrate that? And that fits nicely into mental health as well, but some of the strategies might be a little different. And then kind of the odd one might be climate adaptability, but looking at how climate impacts impact our communities and may impact some of our community members more than others, and how we can help be more resilient to the changes in our climate. All right. Thanks, turning over to Jordana.
So my name is Jordana Sabella, and I am a public health analyst with Pitkin County, and then I also spend part of my time as a public health planner for Eagle County, and really focusing on that western side of Eagle County. And so I'm here today to help us through this conversation and to help paint this regional picture of what are the current strategies that are already going on in the communities to address overall increasing mental well-being overall. So as Becky mentioned, we have the priorities, mental health and healthy housing. Today we're focusing in on mental health. But the questions that we're grappling with are who's already at the table, what's already happening in the community. We know for these to have become priorities, there needed to be some momentum around them, a lot of work already being done. What strategies do we need to implement to make a difference here? We're all working on mental health, but as Chris was mentioning, we've got to really detail out what are those strategies, what's the case for it, how do we move forward? Another question is, how do we track this work and make it transparent within the community? So if we flip to the next slide, we'll talk about one way that can happen is with a strategy map and a dashboard. Has anyone ever participated in using a dashboard or a strategy map before? Could you raise your hand? So this is awesome. We've got some experience in the room. Would you go to thrivingweld.com if you just Google Thriving Weld? So a strategy map and dashboard helps us track what's going on in the community. And when we say community, as Chris mentioned, we're thinking regional. So what are we doing in across Pitkin, Eagle, and Garfield? Oh, they updated their website. So the healthy eating is a great one. So how do we figure out a lot of the strategies that if we looked at these big buckets, what's going on more specifically within the community, how do we look at that? So the tool that we're going to be using regionally is this strategy map and dashboard. And it's actually another great partnership where we're working with the West Mountain Regional Health Alliance, of which Christina is here today. Christina will wave. So this is a group, if you're not familiar with, who has been convening for many years now. One of their initiatives is to have a dashboard that will cover lots of different priority areas. But the first one that is going to get built out is mental health. So we thought, well, we're working on mental health and want to figure out what's going on in the community. Why don't we help you populate this dashboard? So the first step in doing this is making a community strategy map. So we sat down, we did an inventory of all of the efforts that were going on in the 3-county region, and we tried to group them into big buckets of what are those big strategies that people are really working on around mental health. And then, so in Thriving in Weld County, they did the same thing. And I'm going to share their healthy eating example with you because it's the most robust. So they sat down, they had their strategy map. And then if you click on a specific strategy, what pops up are measures that are populated, if you scroll down, by community organizations. So the City of Greeley, the Greeley Farmers Market populates up there. How much, what is this? The amount of vendor sales at Greeley Farmers Markets. So they track that over time. It's accessible to the community. And so if you go down here, all of these sub-strategies, they set target values, they have their current value, and then even if you click in here, if you click on this one specific measure, it will pop up and you can see how it's looking over time, whether they're moving closer to their goal or not. If you click, The positive addition sign maybe? Nope, it's not clicking. So they recently changed their website, but there is that ability there. So this is what we're hoping to do for the region. We're hoping to pull together and group the strategies so we can really look and see what's going on. Do we have duplicative strategies? Do we have ways that we can align? Do we have some big gaps where there aren't, no one in the community is working on a particular strategy? And then that might help inform the specific work of what we can do going forward. So that is a strategy map, and that is one of our goals today, is to help start populating our own strategy map. Are there any questions? Are you guys just...
How is this going to work with the in-year dashboard project that's being worked on?
Great question. So we have had conversations both with Thriving Colorado, who does the dashboard work, and that group who's working on it through United Way in Eagle County. And so the agreement is that it will be the same strategy map and the same strategies, and it will just be Eagle counties that populate onto the one specific to Eagle County. And then when we do the regional dashboard, it will have all 3 counties. So yes, and it will be one collection method for Eagle County folks who are having to input into both. Great question.
Just curious to what extent we know or don't know what other states or counties in our country are exploring and pursuing mental health care in the same way that you might, which ones you might admire or try to differentiate.
That's a great question. I don't know if I have an example. Becky, do you have an answer to what you guys have been thinking about here?
I think that's part of scoping out the strategies. I mean, if once we kind of see what's going on here in our region, where do we have those gaps? Where might we have a lot of strength? And then start looking at, okay, who's doing this well somewhere else? And bringing that back to this group for discussion.
So, I mean, to be a little more direct on my side, if anybody was doing this well, we would all know about it. It's not being done well. There's this, in public health, we get caught up on best practices all the time. Well, if there was a best practice, there'd be a community with a suicide rate of 0, right? It doesn't exist. So there's some states out there doing innovative things. There's some local municipalities doing innovative things. We will use all those ideas. But what we're going to do is take those ideas and come to you in our community and say, would this work here? Yes or no, or how could we even do it better here? So, there are so many years in public health. It's follow the national model out of, Seattle County. What's the name of the state?
King County.
King County, yeah. Follow King County. Well, King County is great for Seattle, and they do an amazing job for their community. But the mountain area here and the deals the stresses we have with housing and employment and seasonality and all that are very different than King County. So while we might steal ideas from them, we're not tied into following any one way. And that's what's so great about these funds, is they are ours to decide. This is not a grant that we have to check certain grant box and do it a certain way. It's up to us in this room to say what's best for our people and to do it that way. We don't have to follow a script, which is really nice on this. Yeah.
Great. So if we go to the next slide, we'll see the draft regional mental health strategy map that has been drafted out according to what we know has already been going on and what we know are some elements of a robust system and strategy where we're addressing mental health. So the mirror image of this is up on this wall. For those of you in the back, I'll just go through this in case you can't quite see it. So our overall goal is to increase mental well-being across the region. As Becky mentioned in a previous slide, we think there's 3 big parts to that. The first, in terms of outcomes, what are we looking for? We think that we need to increase people who receive care. We think we need to reduce the number of suicide deaths. And then we need to increase healthy behaviors around substance abuse for youth as well as adults. So what do we think are the big strategies that can help us reach those outcomes? First, to increase the number of people who receive care, we can improve access to community services through programs and policies. I know a lot of that has been a big conversation, especially here. Maximize opportunities for screening and referral. We need to expand community awareness about mental health, which can look like a lot of different things, and there's a lot of strategies that will roll up into this one. And then around the substance use, we really need to increase protective and decrease risk factors, and that's a big shout out to the work that's been going on in CTC. So we realize it's not all new. And then also implement programs and policies that reduce use of opioids, tobacco, alcohol, and marijuana. And so we're really thinking about more adult-focused strategies for that group of strategies there. This is a draft, as I mentioned, so if there are any comments or suggestions that you have, that you'd like to see something look differently or include something differently as we go along today, please let me know. We're taking all of those comments from our community meetings to be able to help inform the final draft of the strategy map. So if any comments at this time that strike you, I know you've just seen it.
Well, I'm going to jump off the subject a little bit here. I'm sitting here in the back and I'm looking at this group. We have this huge group here, and I think it's great that we have all this input. And my question is how are we going to steer this? How is this group going to be steered? Who's going to represent in the end that is going to take it up? Is there any kind of strategy that's in place to sit there and say, okay, there's going to be 5 or 6 people or 10 people or whatever? I'm just worried that we're going to get into a deadlock of everyone pitching all this stuff. I think this is a great idea for brainstorming and getting this out there. But is there going to be a core group, and how are we going to get to that core group of people who are going to walk it up?
There's not. And so I'll take full responsibility for getting this to the commissioners. And when the money is there, we don't have key things decided on what to fund for mental health in this community. Shame on all of us in this room. We failed the voters. We told the voters we would come up with the needs of the priority, we'd dedicate their money to it. So it's on us to do. I think us as professionals don't need a lot of hand-holding to organize each other. I look around the room, I know almost all of you personally, and I've only been here 4 months. Many of you have been here many, many more years than I have much deeper relationships. We're going to be transparent. We'll do a voting when the time comes, but again, there's no money for like 6 months. So before we start getting ideas of how we're going to ask for money and how the commissioners are going to do it, we got to decide of what are the gaps. And to do these gaps, we got to do a little work together, which we're leading to here today. And I mentioned it's going to be a little slower today because we got to really assess. But I know I don't, nor do any of you, I think, know exactly the best way to spend these dollars to have the biggest impact in our community, because none of us know all the other things that are going on. I mean, we have hospitals here today, we have nonprofits here today, we have community activists here today, and all of us are doing individual things on our own, but we don't all know what each other are doing. I just learned last week of a huge resource that's coming to the community from one of the hospitals, huge resource, which is a game changer for us, but we can't make these decisions without understanding what everybody's doing. I think where we failed potentially in the past is we all have our own vision of what the best way to do it is, and maybe that is the right one at the end, but we need to understand where we all sit here today. So to answer your question, James, specifically, is I will definitely take it to the commissioners. All of you, we can all go to them. They'll come here and listen to us once we have our ducks in order. But if we just go up and point on the board those things that I have listed, some of you in this room are going to say, Chris doesn't have all the background. There's better ways to do things. Maybe we don't need another crisis stabilization unit. Maybe the schools don't need more resources. Because when I asked Brandon about the school resources, we realized we've never surveyed the 28 mental health counselors that see our kids every day and ask them what we needed. We just made our own assessment that they need more resources because as parents and friends saying our kids don't get services enough, but there was never that survey of those people that are delivering it to ask them. We have done that now, it's coming in. We should have that data by the end of this week, early next week. So I know this is not as formality, as some of you might like. We're not going to spend our time running Robert's rules of meetings and reading the mission statement of a meeting. That's just not what I'm going to do. We're going to get to work. So again, some of you might not want to be part of this, and that's perfectly okay with me. But my promise to the voters was, and to the commissioners, that we're going to bring really good ideas to them that have been scoped and thought out by you guys in this room, that they know if they say this is the thing to fund, it's going to have real impact. It's not going to be the good old boys club or the good old girls club. It's going to be all of us working together. So there's not going to be a hierarchy of decision makers, because I think whether you're the smallest entity here or the biggest, which is Bell Health and Bell Resorts, who are both here today, we all have something to say and we all have to contribute on this. So I know, like I mentioned, it's going to be a little different than what we're used to, but this is what we promised the voters we would do, that it wouldn't just be a few select people making decisions, that we listen to everybody and have everybody's input. So let's go.
I just had a comment on the top three priorities, so to speak here. So if you look on the ends, right, it's talking about what we can increase to, we're all kind of increasing services to have this increased level, but the reduction of suicide deaths seems to me to be a little bit short in terms of, I don't know that, yes, that's obviously the question that everyone's asking. It's what the voters voted on. Folks see the figures. I'm just curious about, is that the best way to focus on reduction by saying to reduce suicide deaths, rather than saying what are we going to do really? Like, what are those, like, what's a better statement to say what we're going to do?
So these are the outcomes. So this is how we're going to measure our success. So what does it look like? And then the strategies are what are we going to do about it? So in order to reduce suicide deaths, we're probably going to have to be doing things in all of these strategy buckets. We're going to have to get out the awareness and the messaging. We're going to have to be doing more screening referral, more treatment, more protective and risk factors. But our overall goal is we want 0 suicides in the county. Whereas, does that make sense, the difference between the outcome of how we're going to measure it and then our strategy of what we're going to do?
Yeah, I guess it just, when you say increased mental well-being, it just seems like the priority is to reduce suicide deaths, which I think through the increased, I don't know, I'm just struggling with that construct, but I certainly get behind it. I think I'm just trying to better understand. It sounds like that's the A1 goal, or the 1A goal, right? Like that's being presented as to reduce suicide deaths rather than the increased mental well-being being what we want as the outcome.
Sorry, maybe this isn't as great of a representation as this one, whereas the increased mental well-being.
Yeah, and I can see kind of how it all funnels.
Is the ultimate outcome, and so we're going to have mental well-being measures, like how many people are reporting in the last 2 weeks that they have been feeling unwell or down and depressed. So there are specific measures that we can use to show these outcomes, and then those other 3 buckets are other measures that we think that we can show as outcome measures.
Yeah, you might have explained this, Jordana, so sorry. That expand community awareness about mental health, is that all aspects of mental health? Like services, symptoms, complaints, access, costs, like what does that mean?
So it's super broad at this point, yes.
Broad.
Super broad to incorporate everything, and then we'll see what folks write up there as to what they're actually specifically working on. Okay. Great questions. So that really brings us to our next step of trying to start to map some of the work that you're already doing in this community. So you'll notice on your table, you have some sticky notes and some markers. Yeah, we can just stick on there there. So now the ask is think about the work that you're doing in your organization to address overall increased mental well-being. Think about your strategies, and the ask is for you to, on a sticky note, write down the strategy that you're working on in your organization, draw a line, and then write your organization underneath. So the goal is, and you might have multiple strategies that fit in multiple buckets, so you can take as many pieces of paper as you need. So I'll give you an example here. So public health. Randy?
Yeah.
Randy, we're going to be talking with you guys in a little bit because we just found out that we will be funded to work with journalists in our communities to do a training about responsible reporting on suicide. We know that how suicide is reported in the media, or whether it is at all, can either increase the number of suicides, suicide contagion, or not have as detrimental an effect. So that's something that public health is going to be working on as a strategy in all 3 counties. So I would write that, my strategy up here. I'd write that public health's working on it. And I'm going to put this under expanding community awareness about mental health. So now the goal is for everyone here to start to write down your strategy or strategies that you're working on, and be sure to include your organization. Any questions before we start?
Do you want strategies that we're already doing, or strategies that potentially we're brainstorming and would like to allow initiatives?
I would say already doing, and if you have potential strategies that are kind of you're considering, maybe just write it down and write potential.
Oh my gosh. Yeah, we have. I also
Oh, yeah.
That gives a lot
We'll do that.
I don't think there's something there.
Yeah.
maximize opportunities for things yeah, that would be
I know. I'll put it next to her.
He's on the phone, so we'll grab it.
Come up and let's take a comprehensive look at what all of your colleagues have written up and posted here and see if if there's anything that jumps out to you. If there's anything that you see up here that you didn't know about that was going on before. Does anyone want to come close and look at the wall? Can you read it from there?
So all of these things, so we have another section that we're going to go on to that moves from this. But all of this is going to be organized in a really clean one pager for you, maybe 2 pages. We'll be shared all with you guys within 2 or 3 days. So again, nothing will be wasted because each one of these projects, we're now going to scope.
So I think just what we usually find when we look up here, when we're going to be calling and taking this information, starting to organize it. We're going to be asking, are there any similar efforts? Are there any opportunities to combine or align? Thinking about who's missing from the map. Is there someone who's doing a whole bunch of mental health work in one of these areas who isn't here? And we want to make sure to get their information up here. If you have thoughts about that, come see any of us and we'll make sure to reach out. We'll then be using it to help ask the question, are there strategies that are missing that helps go up on our gaps board in Trello? Looking about, are there strategies up here that are evidence-based? We want to make sure no one's using the DARE program, which has been actually shown to increase use of drugs among kids. Is this work, and then is this work measurable? So making sure that when we're putting strategies up here, we're making sure that we're accountable and that we can associate whether we're helping to reach our goal and making that progress. So in that light, I guess I'll just ask if anybody who's taken a comprehensive look, was there anything that struck you or stuck out to you that you noticed up here? Okay, well, we'll give you the cleaned up version, and then I'm sure you can have some additional feedback for us. So, yeah, thank you. So these handouts right now that we're going to give you are going to help you work through also including your strategies on here for us, but indicating how we're going to measure that strategy. So as we saw in the example, as we saw in the example from Wells County, each measure, each strategy that the community partners put up there on their dashboard had an associated measure with it. So for example, if you go forward, this is the form. My ask is at a minimum, if you could please put your name and your contact information up there, and then your organizational strategy. So what is it that you wrote up here? In this strategy map link is what piece of paper did you write it on? Was it under A, improving access to community services, or E, thinking about substance use? So just so we have an idea of where you think your strategy fits. And then your measure. So how are we going to know if what your strategy is, if what you're doing is successful? You go to the next slide. I've got an example up there. So back to what we're doing in public health is we're going to do this responsible reporting on suicide training for journalists. And how are we going to know that that has made a difference? What we're going to measure is the % of local coverage of suicide that meets all of the checklist criteria. So every time there's something in the paper, we're going to go through and measure and make sure that it's been reported in a way that's consistent with that training. Public health is going to collect it, and what's our target is that 100% of those articles are going to meet that criteria.
Don't mess up, Randy.
That's our goal. And we're going to be doing it in Pickton, Eagle, and Garfield. So if you write down your strategy and you're just at a loss for, I don't know what a measure is, I don't work in this world, I don't know how we might be able to do this, just leave it blank. And you will be followed up with from some wonderful person from public health to help work through how you can make your strategy measurable in a way that makes sense. And then we'll also help work through what that target is. How can you pick a target that is meaningful, that's a stretch, but that's also achievable. So that's something that we're not going to set for you. It's up to your organization to set that target to be ambitious, and knowing that it's going to be up there and it's going to be public. So anything that you're going to be including on these measure sheets, the ultimate goal of it is, or the ultimate endpoint is, it's going to be up on that shared regional website as well as the Eagle County specific website. And our primary goal at this point is that those measures are going to be updated once a year. So you can think about having a whole year's worth of data, and that's what we're thinking for right now. So any questions at this point on what you're supposed to do with that sheet in front of you?
There's one block per city.
Yes, precisely. If you need more paper.
Yeah, Molly, we can maybe just send, you guys are, Mindsprings is a different boat. You guys have hundreds of stuff you're doing. We'll take you individually. Yeah.
Just, at least just put your contact info and just let me know if you need to follow up.
Huh? I don't have it. Oh, which one? Yeah. Oh, yeah.
Hey guys, if you don't get all of them written down, it's no big deal. As part of the follow-up to this meeting tonight, we'll email you this form right now, and you can fill out as many as you want.
I do.
Yeah, and if you're not the right person, you can get it to the right person in your organization to do that.
Yeah, I think our big request is just making sure that we've got who we need to follow up with. Probably going to be a little bit So we'll give a couple minutes here to fill things out, and then Chris is gonna wrap us up here.
I'll get two calls. Oh, okay. I guess Right. Well, thanks for sharing.
The idea is to have it have the speaker and the measure and broadcast. There's an Eagle CNC and one with CNC.
You're welcome to come in person, and we just know that forward time is very valuable, we want to be able to come in and out.
Computer is closed down, but I wanted to, so we retain the community benefit community.
Okay.
So if you have.
Yeah, we'll add it.
So we can.
Okay, no problem. Yeah, we'll add that to the sign up, no problem.
Okay,
Yeah.
then it's turned off right now.
You got it.
Okay,
Yep.
no worries. Thank you.
Yeah, thank you.
All right, we're gonna pull everybody back. You're still working on okay. If you got your contact information and at least a strategy, or just your contact information on there, we will continue to follow up. And thank you so much for the work that you're already doing. And just to wrap up, you will be putting this all in a user-friendly manner and sending it back out so you can review it and give us feedback if you're like, oh, this is what stands out, and we'll put up those things that we were thinking about too. So we'll get that done and back out to you. That's our next step to you. But I want to make sure to leave some time. I know probably a lot of you have some additional questions for Chris.
Okay, guys, so we've got about 25 minutes. So again, we're going to use all this information to create situational awareness about what's going on across the region. You're not going to be asked for this information again. Okay, so that was the first meeting. We got that. We're going to follow up with all of you to get more details of that information, to really flush it out, make sure we didn't forget any key individuals as part of this. But we'll now have a situational awareness of hopefully everything that's going on and then how it all works. So from there, we got to start looking at, okay, knowing that this is going on, where are the gaps? Some of you already wrote some of the gaps up there. Awesome. Helps us out, but we'll help flush out the gaps. So by January, when we have our next meeting, we're going to do it quarterly. We're going to have all the gaps identified, as well as the situational awareness map that we just started building here today. You guys will all have that way before January. You'll have time to comment on that. If we missed something, if we didn't represent your need or your community needs or what your organization is doing, we'll have it all there. Does that make sense? So we're not going to do this drill ever again. This is a one-time drill. Thanks for your patience. We'll have that to you before the next meeting. So at the next meeting, we're going to look at that map, look at everything that's going on, and really start thinking about what's the prioritization of where we need to start directing A1 dollars and start having that open conversation, that debate, if you will. And I'm sure it will be a energetic debate for many of us about where those resources go. By March, we should be able to put a list together in front of the commissioners. But I want to just stress again, the money doesn't start trickling in until January, and it's a slow trickle. And for those of you that are aware of the pot cycle, there'll be no outdoor harvests until fall, which is probably half of the revenue, if not more. So I just want us to all take a breath and be realistic. It's going to take time for the money to come in, but as it comes in and as it builds up, we are going to be well ahead with key activities that need to be funded. Now, these key activities, hopefully, a lot of them will get funded by other needs beforehand, right? As we already talked about, we're already working on other needs. There's other grants, there's other organizations, there's other opportunities. So hopefully, A lot of those things will get funded, but there'll be some that don't get funded that will require A1 dollars. But $1 dollars, the marijuana tax, cannot fund all of our projects. I've gotten so many emails in the last 72 hours and phone calls from everybody. Oh, good, we don't have to send money to detox anymore. Oh, we don't have to do like this. No. We're going to have to find money and dig up and scrap together to keep hitting all the things we need. We just have a steady stream coming in that'll be helpful. Does that make sense? So before we go around the room and introduce ourselves and what is the most important thing you think across the community that needs to be addressed related to mental health, I just want to ask if there's any questions that we haven't covered before we open it up for introductions and what you think is the most important gap that we need to fill. No? Okay, so we'll start with Becky.
Great. I'm Becky Larson. I'm with the County Public Health and Environment, and I'm waiting to see all of this put together before I can say what the.
Oh, man.
Yeah.
My name's Janine Benson. I'm a physician with Kaiser, and I actually am a primary care doctor at our clinic in Edwards. And I deal with this daily basis with patients, and I think from my perspective and my providers that I work with, we have real problems with people who don't need to be on 72-hour holds but need intensive acute care, and that's a huge gap. So we struggle with that on a daily basis in our clinic.
So for the folks that might not know what that means, specifically we need beds, right, in the community? Like
Not
respite care beds,
even beds. It
Okay.
just needs, be able to get to see a psychiatrist within a couple days, and then needs, it's through the IOP, an intensive outpatient program. So, but we have come across where when you do need a crisis bed, I mean, we've had that issue multiple times too.
Oh, I know we're skipping me.
No, you're not skipping you. Why would we skip you?
Because I'm not the community health person.
No, we're all here.
Okay, I am Susan Fairweather, and I am with Kaiser Permanente and also a lifelong resident of the mountains communities in Summit, and having also worked and lived in Eagle County. So having a 50-plus year perspective on the evolution of our rural resort area, I see a number of things contributing to why the mental health issues, and that includes housing, security in housing, security in food, security in income, and a sustainable wage, not just a minimum wage. So you're not going to probably tackle all those things, but in my stead, one of the things I get to do is bring our community health experts from Kaiser into this discussion. So I won't be continuing these meetings, but I will be asking one of my community health professionals out of Denver to join this group in bringing some of the solutions that Kaiser is looking at nationally to tackle this particular community health issue. It is one of the highest priorities for Kaiser Permanente right now as we speak. So there are a lot of resources we're looking at, and we want to help bring those things to this community.
I'm Molly Fiore, and I do a couple different things in the community. I work for Mind Springs Health and coordinate the peer services in the rural resort areas. But I also am the program director for Speak Up, Reach Out, the Suicide Prevention Coalition. So I think I'll just speak to the needs that I see coming from the Speak Up, Reach Out, the Suicide Prevention Coalition perspective, and that is funding and collaboration to really help with that awareness piece. We offer all kinds of trainings, prevention trainings, intervention trainings. We have a lot of those, and we just don't have just that small nonprofit that we are. We don't have the manpower, we don't have the reach, we don't have the dollars to spread that as much as we need to spread it. I've seen such an increase just since the 1A conversations have started in the amount of individuals that are showing up in those trainings, in the community talks and all of those things. I think a lot of that stuff is done after hours in volunteer time, and I think we really need to put some funding behind that so that those
all those things that really help reach out into the awareness can continue.
Christy Grimes, Program Director of Mindfulness Health here in Eagle County. I really can't say one. I think they all tie into each other, and I'd love to see us looking at more upstream and really doing a lot of work in prevention and youth, and as well as more boots on the ground to help the acute care pieces, since our crisis calls have increased so much in the past couple of years. That more support.
Hi, I'm Jackie Swamstad, Regional Director with Mindfulness Health, and I would echo what Christy said, more prevention, early intervention, but also more intensive crisis stabilization services, and whether that's beds or in the community wraparound or some combination of those things. I think having some of those higher end services is important.
Mike McWilliam, Eagle County Undersheriff. I think drug and alcohol abuse and its impact on criminal behavior.
Greg Van White, jail administrator. I think a lot of what we see in the jail is the need for the crisis stabilization beds. Oftentimes these inmates stay in the jails with minor criminal charges. That's how they come into the jail. And we have a hard time getting them paired with resources. And just the re-entry portion, pairing these inmates up with quality resources prior to being released so they can be successful in the job.
I'm Randy Simmons, Director of the Samaritan Counseling Center. Crisis stabilization is without question, but I want to take it one step back. I think we need some access to care for middle class folks for whom counseling at $80 to $200 an hour is kind of out of reach, and some way of getting more access to folks when before they get to the crisis point, so that we can perhaps avert some of the crisis issues.
Ada Borg from Colorado Mountain Medical. I'm the Chief Strategy Officer. For CMM, we're on our second, or starting our second year soon for a 5-year transformation of creating care teams and integrating care coordinators for our primary care. One of the things that we realize we don't know is what our population is of patients with mental health needs. We know the patient when they walk in crisis, or sometimes it pops up in our wellness visits, but we've never really looked at the population as a whole. So one of the things we're doing right now is we're going to start integrating PHQ-9, or do the 2 and then the 9, and then helping our care coordinators identify where our resources are in the valley, and then helping the patient connect to that resource. So 1, we don't know what our population is. 2, we don't really know what our resources are, and 3, how to get our patients there. And I think a couple of people mentioned the patients that are in crisis. We don't have the education among our providers as to what they need to do. The providers know what they want to do. They don't know what the resources are, and how to get them there right then and there. And then long term for mental health and also for substance use.
I'm Chris Montera. I'm the Chief Executive Officer of Eagle County Health Service District, also known as the paramedic service. Oftentimes I think a lot of people wonder why paramedics care about this. We do. We do a lot, because most of the time we're on the front lines of what happens. We either get to see it, we're a part of it, we're part of the crisis, or we get to see it evolving. So I think for us, we want to be in this for the continuum and as a part of community health. Part of our organization is dealing with community health. We really believe in that strongly by partnering with primary care and Mind Springs and the hospitals. But I think we have an opportunity, and I think Chris danced around a little bit, and I'm going to be a little bit more blunt, because he knows I am. We have an opportunity to be entrepreneurial in a way that has never happened. And I think it's kind of cool, but we have to all be willing to give up something to get there. And I think we can do that. That's my take on the whole thing.
My name is Carol Hawk. I'm just a citizen from the SALT.
Who didn't want to explain to my fourth grader why someone's dad had committed suicide. And it's just the whole mental health thing I think is really important. So I was really big on getting 1A supported over in the Roaring Fork Valley, and I'm just in awe of all you guys and wanted to contribute what I can.
Thanks, Carol.
Great, Nan Sunday, Picken County Human Services, and I think you guys covered a lot of it. I think, my focus tends to be a little broader, which is around having a coordinated, comprehensive system of care, because I think we actually have a lot of resources, but we're coordination poor. So what's happening, as you said, in the schools, in the jail, in the hospital, at DHS, and other places, and how can we better coordinate? Because we're in a small rural area, we're generally serving the same families with multiple touches. So I think there's a lot of hope.
Christina Guerin, I'm the Executive Director of West Mountain Regional Health Alliance. You guys are all really good. I'm echoing a lot of that. I agree with Nan on the system of care. I also think addressing access to mental health care as well as connecting folks to other social determinants of health, because the clinical piece is not the only piece that it touches.
Hi, my name is Michelle Stucker. I serve as the Executive Director with the Eagle River Youth Coalition, and a focus on youth I think is so important. We have young people here in this community that are facing really tough situations, and I love that the school counselor component was really highlighted as a big opportunity, but I worry that we're thinking just high school and just district schools when there's a lot of needs beyond that. Not just counselors as in responding or addressing young people in crisis, but I think about the need all the way down to some of our youngest citizens here in the community, and the need to invest in social emotional learning and some other components to help make sure that they're better prepared to be resilient and be able to thrive as they get older.
I'm Katie Haas. I'm with Eagle County Public Health, and I'm thinking about making sure all of the unusual suspects, perhaps, have a voice at this table in the decision-making process. I think that there's a lot of people that are respective organizations and such are connected to or know issues at hand. Bring them into this.
Megan Birch with Eagle County's Department of Human Services, and I'll echo some of what Nan and Christina said about making sure that the families that come to us are then connected to services, because we touch a lot of families in crisis, whether they need financial support, medical support, food support, or come into contact with our child welfare or adult protection teams. That we touch a lot of families in need, and making sure that we have the right systems of care that we can plug them into right away, and making sure that our staff is fully informed and knowledgeable and able to handle those situations when they come to us.
Hi, I'm Sheila Sherman. I am Chief Nursing Officer for the Bell Health System. And, from my perspective and the organization's perspective, we see a lot of these patients in crisis, whether it's mental health or detox situation, coming into our emergency department. And we're not a psych hospital. We all have minimal training within the realm of psych. And so our goal is to partner and collaborate with mental health, whether that's through telepsych. Our goal right now is telepsych, to get that implemented so that we can get access to that care as quickly as possible, as well as expedite placement. So that's our goal as an organization, and we work closely with law enforcement and our EMT ambulance, Chris, to it's just such a sad situation, and I always want to have a voice for our patients, regardless of what their issue that they're presenting with. That I'm always going to ask that we remain in the space of being compassionate for this patient population. And I think this is just such an incredible voice that has come together for these patients and people in our community to try and help them. So I just want to say thank you to everyone for these efforts and what is taking place. So, I'm excited to be part of it.
I'm Ron Teddy, PD. I think our focus is a little bit myopic. We're looking for a place when we encounter someone anywhere in the mental health spectrum, bring them so they can get help. Right now, we're kind of piecemealing something together, hoping that it works out. So it'd be very nice for us to have a place where we can bring them, get them out they need. Secondly, drug education. I just moved here 6 months ago from South Florida, which is the drug capital of the world, and I'm amazed at how long we wait to educate the youth here about drugs. So if anything, I think we're a little bit naive about what age kids are finding out about drugs in school. So if we can push that education down, if you don't think they know about it, you're wrong. They do know about it already. They're already talking about it. So if we could push that education to them down, because we're already losing them by the time they get to high school. So.
I'm Greg Allen, Chief Police in Avon. I'm also the board president of Speak Up Reach Out, and Molly has mentioned all of the stuff that we're involved in. A couple of sort of thoughts I have. Unfortunately, in the past, this county has reacted on the basis of tragedy. That's what's motivated people. Our coalition was formed in 2009 on the basis of a significant tragedy in our community, on the loss of somebody who was much loved by a lot of people here. And ultimately, his passing, spurred the Avon Town Council to ask the question, what can we do? And we, the police department was asked to look into forming a coalition, which we successfully did, but the coalition has survived on a huge amount of volunteerism from our community. The dynamic of treating people with mental illnesses in this county has thankfully changed. Some great leaders in this room have taken a different perspective. In the past, as law enforcement officers, when we were dealing with somebody in mental crisis, our protocols have been put somebody in protective custody, which usually puts them in handcuffs because we're concerned they're going to hurt themselves or others, put them in the back of a barred or a police car with bars on it, and drive them to a station. And then ultimately what's happened in the past is they have been transported to a mental health hospital, either in Grand Junction or in Denver. And I ask you, what's the difference between that and a criminal? It's been the same, outside looking, dealing with a criminal as somebody with mental illness. So I'm glad we as a county have taken a different perspective on that. And I give a lot of credit to Chris Montero and Eagle County paramedics, because in the past, the paradigm has changed. And paramedics will come now and treat that person with an illness versus the old paradigm, and they get treated as a patient. They get transported in a hospital, in an ambulance, and brought. And again, I give a lot of credit to Jail Health and the other hospitals for stepping up and helping. But it's been a challenge for all of us. And like everything, it's resource dependent, and we have not had enough resources. So obviously, this is a fantastic opportunity. I do credit Chris, butted heads first time we met. Then we sat down for coffee, and we've been buddies since. So but Chris asked the question, and it was a great question at the time. I just got a bit passionate about it, my response. And that was, why are there so many 501c3s in this county? That was the question. And my response was, because, excuse me, bloody government weren't doing anything. Use my Irish bloody. They weren't. We weren't getting support from government in general here in this county. So this is, and thank you, Chris, for obviously the leadership. An amazing 4 months of being here and taking the lead on this, and for all the other people who have been involved in the campaign, I really appreciate it. But this is a phenomenal opportunity going forward. We can talk about what's happened in the past as context for what we need to do in the future, but I think we should all be forward-looking in relation to what we as a community and every aspect of our community can do to accomplish these goals. So I'm very proud of our county, our voters, of everybody in this room, of all the people that have been involved in it, to be serious about what we're doing, because there are people in crisis. We, on the law enforcement side of it, and paramedics and all the different first responder, we see it, unfortunately, on a daily and nightly basis. And it is so sad, because people are in crisis and they feel that there's no hope for them. So I think it's just, as a community, coming together and offering that hope is the most crucial aspect of what we're going to get out of this. The money is one piece of it, but it is only one piece of it. It's this collective sort of forward motion and a invigorization of our commitment to mental health here. And we've got people that have come out from, that have never been involved in it, have been motivated by this. And obviously a lot of lessons learned from the campaign and how to reach out through social media. And Chris was giving some statistics there recently about the, was it the Instagram or what was the
Instagram with the youth.
Yeah. So what, how many?
So I was with someone from Mind Springs.
Oh,
no, there's another one. So anyways, I was at Colorado Mountain School, and we had a bunch of kids in high school that volunteered their time to talk about mental health, and we were talking about the 1A campaign and what we were doing, and I was asking them as non-voters what we could do to help influence the vote, and they're like, why not use us? We can talk to our parents and make sure our parents vote. It's like, wow, none of our campaign is directed towards the youth. So we spent $2,000 on Instagram and Snapchat ads just to kids in Eagle County, 13 to 18 years old. And they had a 15x return on clicks versus all the adult ads. Wow. Meaning they engaged 15 times more on those ads than all the adults did. And it was highlighted. They care. They want to talk about it. It was mind-boggling because we almost missed it. And this was the youth's idea of how to engage them. And who in this audience would have thought running a campaign to non-voters to flip them, right? It's just not standard operation. So it was a big opening for all of us.
So, from that perspective, utilizing that knowledge that we gained to use that as a mechanism to get to the people that we're trying to get to, especially from the suicide prevention, our youth in our community. We go into the schools and we do prevention education, but we get 45 minutes to an hour out of their year because the curriculum is so busy. So but it can't just be that, it needs to be an ongoing basis. So anyway, great collection of minds. I would just encourage everybody to keep, this engagement because, we're on this wave. If people jump off it, the wave is just gonna, collapse on us. So let's keep going. Thank you.
Jacqueline Cartier, Winning Images. I focus on critical communications and management. And basically, what we've got is pretty much what Greg and what Chris have said. When you've got this kind of passion, you've got this kind of interest, you have this kind of need in a diverse community, how is the best way to deliver the message? How is the best way to collect the message? Everybody in this room has a very specific focus. And that focus, in order to unify it and deliver it to the community, is critical because everybody has their own way of communicating what it is that they want. And it may, on some level, appear to conflict with what someone else needs. So you've got the input of communications where you're saying, this is what I need to do, and someone else says, maybe we need to do it this way. And we bring all of that together. Then you've got the other end where the person who's receiving it, and the way you deliver something, to Chris's point, if you're delivering to youth, you don't put a newspaper ad, right? You go on social media. You go the way that they will receive information. You also have to use words that are... Randy, what are you doing over there?
Obviously, I'm dying of extinction.
You didn't need her.
But the way that we're going to communicate to someone who is a provider is obviously different than somebody who is in need and in crisis. It's going to be different to a young person than it is to a professional, than it is to a senior. The words that you use, the syntax that you use, the emphasis, the passion, the way you deliver the passion. There's a lot of passion in here, and it can all get wasted. So bringing all of that together, both during times of crisis, but also continually. How do you get them to continually engage? People get bored easily. We are in an instant gratification mode. Somebody sends you an email and they don't reply within that day, that's it, something's wrong. You get a text message, oh my God, heaven forbid you wait more than an hour. So when you've got that kind of instantaneous response, and whatever you put out there is going to live forever, because once it's digital, it can go forever. You can delete, but it's never gone. These are all things that we have to consider, so that when I'm using a certain word in a certain demographic, it'll have different meanings. If you say something in one way to a young person, to a teenager, it might have an entirely different effect than somebody else. And we also have diversity. We've got a huge Hispanic community. It's helpful if you can incorporate cultures into the delivery of what it is that you're doing. And being able to get rid of the stigma that is associated with mental illness. And that comes from first acknowledging that it's there and why it's there and how that transitions. And that's a big, big issue, because we can do everything we want here, but if the person who needs the help is worried that they're going to have a label that they are somehow dangerous, you know, because previously they've gone to jail, or unstable, now maybe they might lose their job, or they're going to be ridiculed, gee, the kids in school are going to find out, they're not going to come to the table. So how do you get them there? And that is a strategy that when we get it all put together, until we can reach those individuals, it's not going to have the effect that we want it to have with the reduced suicides and so forth. So that's what I focus on. Good turn.
James Van Dink, County Sheriff. Again, reflecting on all what, touching on everything, but probably the biggest thing for me is continuum care from start to finish. Certainly, as Greg has attested to and so on, we have a large population inside the jail. Anywhere from like 50 to 70% of our population is dealing with either alcohol, drugs, mental health issues in one way, form, or another. Would love to be able to prevent a lot more from coming into the facility, and then also many of them once they're in the facility, keep the recidivism rate down and to get them back in. And so tying into the community and to stabilize, like what Ryan attested to and Greg also attested to, is I'm a big proponent of a one-stop shop. It makes life a lot easier for a lot of us, but it is someplace to go. We got someone who's in crisis. Let's divert them and let's find an alternative way, as opposed to putting them in jail or putting them in the cuffs, to get this person the care that they need, and that they're not labeled. And kind of what you were just talking about is, this person's in crisis. You know, part of it's the education, making everyone know it's mind and body. It's not just the body. This is a community health problem. You know, it's not a law enforcement problem. It's not a paramedic problem. This is total community health, and we need to be able to deal with that. And so that's kind of my big goal.
I'm Veronica Lehman. I'm the doctoral psychology intern at Bright Future Foundation, but I also have past school psychologist in the district. So kind of taking both hats, I guess. I'll keep it short, but just kind of focus on prevention. I think, especially with our youth, you know, there's need for intervention, but I definitely think with the prevention that we can do early on for kids in the schools, so that, you know, longer term we don't have some of these issues that we are seeing. And then within that, just kind of improving access to community care. I think what Randy said, like that middle class population, and even within that, and this goes on with prevention, but like, you know, relatively speaking, this kind of lower level of needs. We've been talking a lot about crises, but what about people who are just struggling and they need access, and they, you know, there's a stigma, but maybe they don't even have access, or they don't know where to go, and they just need to talk to somebody, but it's not like they feel like they're in this overwhelming amount of crisis level. So improving access to care for people who are sort of at this lower level need, to then prevent it from reaching sort of crisis level. So, and then lastly, you know, with Bright Future, we do a lot of trauma work. So not only community awareness about mental health, but like improving community entity, I would say, awareness about trauma-informed care. So we do some work with the sheriff's organizations and other local community organizations about education around what trauma looks like, and it's so intimately linked with mental health, of course. And so really increasing awareness of what, not just mental health, but what is trauma-based mental health look like, and then doing that within the schools as well, working with school staff to improve understanding and provision of trauma-informed care.
Hi, I'm Agnes Harrico. I have a son who's bipolar. That is my passion. And what happened is I had went to, thanks to Mind Springs, a class on suicide prevention. And I came out of there like, oh my gosh. And so in January, I had a fundraiser. And I just threw it together and I said, we need to get this stigma out because that is the problem. That's a big problem here. Also, my son is 28 years old. And a lot of the biggies, the bipolar, my son is bipolar, the schizophrenic, they don't start till 18, 19, 20. We have a huge gap here in that I see. I hold a support group with parents like me who have these adult kids with these severe illnesses, and we have no assistance. That's why I'm here, to yell and scream, we need more for these kids. Yes, I'm an early childhood teacher, so I understand we need it for the children, we need it for the young adults, the high schoolers, but we sure need it for these young adults, because we have a huge gap in that. I cannot tell you how many times I have driven my poor son. First time we went with the police, chained like a criminal, and after that, I would drive my son to Grand Junction with the Beatles on, that would calm him down. And to do that over and over again, and then leave my child there who is either psychotic or suicidal, and say, I'm sorry, I have to leave to go back to work. I'll see you in a day when I get 1 hour visit and back and forth. We would never do that to a cancer patient. Why would we do it to mental health patients? And that's what we've been doing. So that's why I'm here. Thank you.
Oh, keep going.
I'm a community health worker with whole health management in Eagle County. And having come from 3 years of mental health practice and 3.5 years in criminal justice, I would say, yeah, the biggest one I think is they're not separate entities. They're together. I would guess 70% of substance abuse is because somebody's self-medicating because of a mental health issue. So, realizing that it's not an either or, it's a both is probably my biggest take on it.
I'm Sarah Kennedy. I'm with Eagle County Public Health and the coordinator for the Community Health Center program working with Brenda. To reiterate a lot of what has been said, I think it's important the coordination of services, because a lot of the people that we're working with are connected to a lot of other services in the community, as well as the connection to the resources for individuals who need wraparound services, and like Greg said, for jail populations coming out with no connection. I think that for me is the biggest, most important.
I'm Molly Hadley, and I'm the Eagle County Communities That Care Coordinator. Communities That Care is a statewide initiative funded by state marijuana tax dollars. So it's an evidence-based framework that the whole model is around increasing protective factors and decreasing risk factors. So we've already prioritized our 3 risk factors and 3 protective factors. And hopefully in 2018, we will start to implement strategies to reduce risk factors and increase protective factors. Just conversations I've had recently is the importance of social emotional learning in all our elementary schools. So not just a few of them, but every elementary school student should be getting those programs. And then also substance abuse programming at a much younger age, and making sure that every single kid in Eagle County is receiving those, not just because they go to this school instead of this school.
I'm Kevin Howell with Vail Resorts. I'm also Communities That Care board member as well. So when I kind of look at this, I think this is the example I would have of what the biggest gap has been. Not having as many people in the room talking about these concerted efforts. We've always had a focus on, environment, education, and, youth is in the sense of how we support our communities that we work in. And 2 things that have risen in the last couple of years has been community collaboration, and mental health. So glad to have a seat at the table here, to be here and help support this. But I mean, those are things that I think it just warms my heart to see folks from all different sectors here, because I think this is what it's going to take for us to, one, to the point of being transparent and meeting what the voters have asked of us, but more so to affect real change.
Terry Schreiner, I'm the Behavioral Health Manager of Mountain Family Health Centers. What we'd like to see is, I think Dan kind of said it pretty clearly, is look around the room, the resources are there. But it's just, they're all in silos. And so we have to come together. No, that's Chris, that's going to be a big job for you.
Oh, it's not me, it's all of us.
Well,
I'm just a cheerleader, yeah.
Yes, exactly. But the services are there. We need to integrate it. We need to being part of an integrated care program. That's what I'm always looking for. I want to give you a quick example here, what it looks like. While we're kind of talking, I'm getting text from one of my therapists at Avon Elementary School. He has a crisis, a young child who is suicidal, has another child that is going off, so he's trying to help. So he has the school principal there and assistant principal working with one, calling Mind Springs, so the emergency worker can go work with one child while he's working with another child. So you have 3 different entities working for these 2 kids. And I think, what if no one's there? What would happen? So that's a good example of, using different resources to help out a child.
I'm Pat Hammond with Veteran Services for Eagle County, and I work with veterans and their families. We do have lots of resources, and I'm incredibly thankful for that, because we certainly use community resources since we can't get everything we need from the VA. One thing that we don't seem to have, though, is crisis beds, and that's what I desperately need for veteran care. I'd love to see more mental health professionals in the jail, because I'm afraid a lot of my veterans end up in the jail and enjoying your hotel situation over there. I'd love to see more mental health professionals be able to work there. And then we are hopefully getting more mental health care for veterans out in the community, but I'm in desperate need of mental health providers who are willing to work on the choice program and who understand PTSD and TBI. And I hope that happens one of these days. I'm thrilled to work with all of you, and thank you all for being here.
My name is Michelle. I was the executive director of the Aspen Health Center. We have divided our role. I am now the chief clinical officer at the Aspen Health Center. We are now the Hope Center also. So a conversation like this in 2008 is where the Hope Center came from. The community got together and said something needs to be done. The Hope Center is the only freestanding crisis entity in the state of Colorado, and we are one of 3 in the entire country. Our specialty is crisis, that's what we're doing. And so listening to all the conversations here kind of excites me, because this is the conversation that prompted us to be born. The crisis clinicians, that's their specialty. We have a wraparound program that keeps people out of the hospital. It's not called an IOP because it's not a typical IOP. Our goal, honestly, is to keep more people out of the hospital. Out of about 750 people we see every year, we hospitalize approximately 8 to 10 because we have a wraparound program that keeps them in the community. Pickens County is starting a community paramedicine program, as it says here, and our goal is to be able to have them go out at scene. We average approximately 55 crisis face-to-face assessments every year. We average about 20 on-scene responses a month with law enforcement. Co-response is our specialty. So our goal is to be able to respond to some of the invitations we've had from other counties to say, what are you doing and how are you doing it? And we're another rural community. Can you bring some of that to the table? We are not a big entity by any stretch of the imagination, and we do not cover mental health A to Z. We cover crisis stabilization, and our education and school-based programs. So it's crisis prevention through to recovery. I love the statement about the middle class because that's our biggest population. We call them the invisible class because they have nice houses, their kids wear nice clothes, but one little thing in their lives and they're pushed over the edge. they're not suicidal, but they are struggling deeply and don't know where to go. Some of them are suicidal. I love the comment about the entrepreneurial opportunity we have here, because 501c3s exist because people say something's not working, let's take matters into our own hands, and that's a lot of what's around this room are 501c3s. So I think we have the ability as private entities coming together with public entities to be able to say, what can we do? Just because it's always been done this way and just because this has always been what we've done, we don't have to keep that as status quo. What can be done differently? So I thank you for the invitation and for being able to be here, and look forward to see how all that pans out. So, the other half of the summer.
So I recently joined the Hope Center as the CEO, and I'm already working closely with Michelle. And I'm looking at that board and all the sticky notes, and I'm listening to a really great group of people who are articulate, well-educated, and in aggregate, it's possible that we are compensated to the tune of $5 million or more as a group of people. And I don't really care where the next dollar goes. I just want to know that it will help prevent another call from Michelle that says, a young boy of assault took his life last night. And I think we all need to take ownership of it and view it as a failure on our part, and that we are successful if we use metrics to say that the number of crises are reduced over time and the number of suicides are reduced over time. If we can do that, then as CEO or whatever title, I've done my part. So thanks for that.
Hey, my name is Hannah Ross. I just moved here from Florida about a month ago, so I'm really brand new to the community. I'm working with the school district. This is my counterpart with me in two ends of the valley, working at two middle school, Legion 1 high school, providing prevention and intervention services for substance abuse and mental health. So we're going to be doing a lot of screening. It sounds like from what I'm hearing, one of the biggest needs is making sure after we do the screening and we've identified kids as needing services, that they're able to have that access to the services. And then also we really, in our position as grant funded, we really want to work on increasing those protective factors within the school environment. So really focusing on that as well.
I'm Candace Eve. I know about half of you in the room. I've worn so many different hats in the community. But I recently joined with Hannah at the school district. I worked with Michelle at ERYC for a long time, substance abuse counselor by trade, and then I just moved over from the county. I was a supervisor for child welfare and adult protection and their prevention programs. So I'm super excited to be here. For Chris Lindley, got an email from me at like 6 a.m. Congratulations, just so yeah, because I think we took a huge step within our community, and it was something that everyone has been trying so hard to do for so long, to not make this something that's so taboo in our community. And everybody thinks everybody's so happy-go-lucky, and we have so many resources, and we're so rich in so many different ways, and they didn't want to talk about this stuff. They said, oh, that doesn't happen here. No, it does happen here. We do have some issues that we need to address, but the community's buy-in with 74% passing this was, it's awesome. So I think we took a huge step in the right direction, and I am so blessed to feel like we have this community. I sit on CTC as well, and we have 30-something members that come to that one consistently as well. So there's a lot of momentum in Eagle County. There has been, but I think now we actually have even more momentum. So I'm really excited. I would say that aside from just the community piece of everyone, not wanting to talk about it, not really knowing exactly what's going on, the awareness, I think that we lack capacity. And we lack the capacity as far as being able to have accessible services and make sure that they are available to the right populations. So that's my 2 cents, a lot of what you've already said, but I'm really excited to hopefully get some services to the kiddos in the middle schools and the high schools, and then even talks are happening about with CTC and down the road, is there going to be a possibility to have someone like us in the elementary school? So we're talking about it, we're making the right steps, I think.
My name is Carly Carr. I'm the trauma care coordinator for Eagle County Human Services. I'm really excited to be here today and hear everybody's excitement about it as well. I agree with a lot of what everyone says, but I think for me, I'm most excited about the idea that what's really the crisis that's happening on a daily basis on the ground level is finally colliding with a system approach to create this beautiful storm, hopefully, that gives us what will better serve the people in our community. So that's kind of where I am, and I'm going to stop there.
Yeah, sure. I'm Brandon Williams. I think about a month new here on the operations manager from Eagle County Public Health. And having pitched in, and I'm also a resident nerd, which is why I'm anchoring here in Nerd Corner. But whether it was on the campaign, pushing out the social and digital ads and the messaging, or from the professional services here at Public Health, I'm really looking forward to making sure we stick true to that commitment on transparency and accountability, and making sure that we're using some of these tools to be able to help share and break down those silos and make sure that message gets out.
So in closing, guys, there's no question this is the right people.
I had,
sorry.
I had one other week during the broadcast. No, I wanted to make sure we didn't overlook. Rebecca Canali was from United Way, executive director, was also on here, and she wanted me to chime in that there were a couple of things she was excited about. Strategy map, meaning the collaboration for the funding streams, as well as making sure that in addition to substance abuse, we also focus on additional focus on brain injury.
So, thank you. And then Gary was also on the call from Mount Family Health Centers. Guys, so we have the right people in the room. The only thing that's going to stop us from being successful is the people in the room. So to the sheriff's question, he left, but are we going to create all this complex structure and keep people that vote? No. You are it. Everybody in the room, if we accomplish what we just said, we will have the best healthcare system the country has ever envisioned. So let's keep working together. You'll get a lot of information from us over the next few days. Everything is also posted on our Facebook page. For those of you who are part of the campaign, you know how much we like social media. We're going to do the same thing with what we're doing here. So please visit our Facebook page for transparency. And with nothing else, if there's no questions, you guys were over. We're sorry, but thank you so much for your time. Thank you.
Thank you.
Yeah, that's the